All right. Good evening, everyone. And thank you for joining in this evening for a very important conversation around COVID-19 and the vaccination and its rollout. As many of you may already be aware, at the start of the COVID-19 pandemic, excuse me, let me step back and introduce myself for those who may not be familiar with me. But good evening, my name is Sylvina Brooks Powers. I am a community advocate in the Southeast Queens and Rockaway community. And at the start of the COVID-19 pandemic, I had been hosting a series of webinars to talk about important issues impacting members of the community. And I wanted to come back and host another webinar, this time centered around the vaccination. I've been hearing a lot of questions about the safety of the vaccination, about the need for the vaccination, one to understand what the rollout of it's going to be in terms of the access and the equity of it all. Many of you may have heard even earlier this week where a report came out that found that there were more people outside of the 5 boroughs that had been receiving the vaccination, and also that there was an apparent disparity in terms of who was receiving the vaccination. And so we have a pretty esteemed panel of medical doctors here from the community that's doing the work, been serving on the front line and really looking to help the community answer these questions that they have and help us to get to a place where we can return to some degree of normalcy, I would say. So before we get started and do an introduction of our panelists, I do want to take a moment to acknowledge our partners for this evening's program. So our partners include Congressman Gregory Meeks, Queensborough President Donovan Richards, State Senators Leroy Comrie and James Sanders, Assembly Member Alicia Heineman, Council Members Idanique Miller and Adrian Adams. We also have partners in clergy with the Reverend Dr. Les Mullins, Reverend Evan Gray. We also have one of our esteemed local partners and who also serves in many roles, including district leader, but Dr. Tony Andrews as well. I do want to give a moment to our partners to speak and give some remarks ahead of the start of this discussion. And so I am going to start in the order that I am receiving notice of who is on the Zoom at this time. So just bear with us. We ask that our partners limit the remarks to about a minute or two so that we're able to jump into the conversation at hand. And so first we have Council Member Idanique Miller.
Good evening. Can you hear me? Okay. Thank you so much, and thank you so much for allowing me to be a part of this necessary forum. And thank you to our panel of credible messengers from our community who were here tonight, not just to validate the vaccine, but more importantly, to bring the facts. And if I could briefly just talking about facts, and you mentioned the equity or the lack of equity is something that we're working on. I chair along with Councilmember Adams, the Black, Latino, and Asian Caucus of New York City Council. We have been concerned from the very onset of the rollout of the vaccine. Clearly, we know now what we were saying a month ago during the rollout, before the rollout began, has come to fruition once the data was released the past few days. Yes, in the first 2 weeks, less than 5% of the Black Latino population were inoculated, although we make up more than half of the city's population. 1/3 of the population who received it lives outside of New York City. And we introduced legislation in the council that our state legislators will be taking up as well, that will ensure that there is equity in distribution, but more importantly, that the communities that have been most impacted by COVID-19, that they are prioritized, the industries, the workforce that have been most impacted, that they are prioritized, and that we have real-time assessment of data that is available so that we know who, when, and how that folks are being inoculated, so that we ensure that there's equity in the distribution of the vaccine, because we cannot have the same communities that were most impacted now continue to not have access to the vaccine. That would only perpetuate the virus as we have seen it. So thank you so much. Thank you to the credible messengers. I look forward to hearing the information so that I can continue to bring back the facts to the community so that we can continue to get back to living. Thank you so much.
Thanks so much, Council Member, and thank you for continuing to also create platforms to get the message out to the community. Just last week, there was a town hall held around this topic as well, and you said it very well. We have to keep on creating spaces to have the conversation so that the community is well informed. Next, I'm going to call on State Senator Leroy Comrie. Okay, we're going to come back to Senator Comrie. Next, I see we have State Senator James Sanders. You're on mute, Senator.
I think, am I here yet?
You have arrived.
All right. Greetings, greetings all. I bring you greetings from Albany, where all is quiet, as it usually is. But it may be quiet in Albany, but it is hot on the ground in our community. This is the conversation of a lifetime, because this is our life that we're speaking about. Whether we get vaccinated or not will have to do with whether our elders live, our children live, etc. So I urge everyone to pay great attention to this. And I'm very grateful that Savinia Brooks Powers is actually leading this charge tonight. And I'm just here to support. Having said that, I shall say no more.
Thank you, Senator. Also, before I ask the next partner to speak, I do want to also acknowledge a few additional partners that we had, which includes Apostle David Cockfield and Reverend Lemroy Pascal. And I also want to correct the title for Dr. Tony Andrews, who is the chairperson of the New York City Health and Hospitals Council of Community Advisory Boards. So I just wanted to correct that as well. And next we have Assemblywoman Alicia Heineman.
Hi, thank you, Selvina, and thank you for putting on this well-needed, much-needed presentation this evening. I am also in Albany. We are in the throes of the budget and making sure that we get what we need for our communities, especially when it comes to COVID-19 and the vaccination. Today, we just learned about 2 members of the Assembly staff that came down with the virus, and this is still going to happen. So one of the things that Senator Sanders said is, being up here, it may be quiet, but the phones and the social media and the emails have not stopped. And I think it's, highly important that we stress, as your experts will talk about, is getting the vaccination and what it means for our community, dispelling the myths and embracing the truths of what our community needs to be protected. So thank you for your leadership. Thank you for bringing this great topic to all of us. And I too am going to sign off because I have to get back on our budget negotiations. Thank you very much for your leadership.
Thank you so much. And next we have Reverend Dr. Les Mullins.
Okay, thank you, Ms. Brooks. Selvina, thank you for, as usual, your hard work in our community tackling and fighting disparities, be it health, food, housing, whatever. You're always on the ball, looking out for community. I just want to take a few more seconds just to voice the concern, and I know that that's one of the reasons why you're doing this meeting, this forum this evening. But the concern in our community is really uh, the COVID vaccine implementation problem that we have as a community, and that is the high level of skepticism, vaccine skepticism that exists amongst us. So the big problem then is to instill vaccine confidence amongst ourselves. There's a high hesitancy rate in our community, and I think at this point we need to amplify voices, trusted voices in our community to build confidence among communities of color. There are many culturally, uh, embedded cultural myths that exist, and so we have to fight those. So I thank you for doing this. Thank you.
Thanks so much, Pastor Mullins. And so we're going to just jump right into it and give the panelists an opportunity to give an introduction of themselves briefly, and then we'll get into the Q&A. We ask that if anyone has a question, we're going to try and get to any question that you have. So for those who joined via Zoom, we ask that you enter your questions into the chat box. For those who are streaming live on Facebook, we ask that you post your questions in that chat box, and we have folks monitoring the questions so that we can have one of our experts to be able to answer the questions that you have for the evening. So without further ado, I will start first with Dr. Veronica Wilshire, who is the Chief Medical Officer at the Joseph P. Adabo Family Health Center. I would like to also, while I asked her to prepare to introduce herself, I wanted to take a moment to publicly say what I've said in private to both her and Dr. Vega, which is to thank you for your continued partnership and willingness to serve our community and always just kind of looking to think outside of the box. It's been a pleasure working with you both, as well as the Director of Nursing, Ms. Lanice Hudson Watson, who has been a dynamic partner as well when we were testing seniors weekly at the start of this pandemic, as well as trying to connect the community to resources. So thank you both for your continued partnership, and to the staff at the Joseph P. Adabo Family Health Center. So without further ado, Dr. Wilshire.
Hello, good evening, everyone. And Sylvina, thank you so much for inviting me to be a part of this forum. It's truly a difficult time that we're going through, and I feel like we have to make sure people get the correct information. There's a lot of misinformation going around, so forums like this is good, so that way we can help to educate people. And our clinic, we have 5 clinics currently, 1 in Brooklyn and 4 in Queens area. And as you all know, Far Rockaway, Queens was hit very badly in the height of the pandemic. And a lot of the elected officials who actually were on the call a little while ago were very instrumental in making sure that we get the help that we need. Sylvina, you too, you were dropping off masks for us. And all the PPE, so we didn't forget that. We thank you. I mean, we worked very hard. I mean, Dr. Vega, she's on, our CEO. She was one of them who said, listen, we have to do what we have to do. We went ahead and opened in our parking lot a testing center when no one else, when nowhere else in Far Rockaway, Queens had a place for the people to come and get tested. And so even Dr. Vega, she's on. It's good to have a leader like her to work with. So we have a good team at Joseph P. Adabo Family Health Center. I've been the Chief Medical Officer there for a little over a year now. I feel like I came on at the worst time in history, but I thank God for giving me the strength, to continue to do what I have to do. But I thank you guys all for always supporting us at JPA.
Such a time as this, I will say, you are in the right place at the right time, and our community definitely needs you. So thank you. Next, we'll hear from Dr. Miriam Vega, who is the Chief Executive Officer for the Joseph P. Adabo Family Health Center.
Hi, good evening, everyone, and thank you, Selvina, for inviting us. Dr. Wilshire, I think, kind of captured it all, but what I will focus in my remarks is that I too started over a year ago. So, starting at a at a place during a pandemic, it's been really interesting times. And throughout this whole time, our main focus has been the community. How do we help the community get through this? And we want to thank all of you who have supported us and provided us with PPE to help us get through this. Right now, I do serve as an ambassador to Cuomo's vaccine task force to ensure equity. And let me just mention 3 things about equity. It's about availability, accessibility, and acceptability. And we have to work on all 3 together as a community to help ensure that the vaccines do get into the arms of the people who need them. And so we have been doing vaccinations of the public, and we can talk more about that later when people have questions about it, how it has rolled out. But our focus has been on those 3 A's: accessibility, acceptability, and availability. And thank you for your time in putting this together.
Thank you so much, Dr. Vega. And, next, we are going to have Dr. Karen Muir, who is the Director of Pharmacists at St. John's Hospital. And I definitely want to make sure we elevate the voices of the only hospital on the peninsula that is, that's present here. And so we recognize the hard work of the staff there as well. Especially during these times. We know that the Rockaway in the Southeast Queens community was hard hit in this pandemic, and St. John's nonetheless was also hit extremely hard, where we saw, the outside morgue and, heard about a lot of stories in terms of the devastation and the loss of life. And so we thank the staff at St. John's as well. And so without further ado, Dr. Muir.
Hi, thank you for having me. So I'm Karen Muir. I'm the Director of Pharmacy at St. John's Episcopal. And one of my responsibilities is to make sure that I procure the vaccine and any other medication that is used in the treat of this COVID-19 pandemic. As you stated earlier, we were one of the first hospital that got the first COVID patient in this area. And so we also were one of the first, was part of the first hospital that received the COVID vaccine. And the vaccine that we received was the Pfizer vaccine. We started to vaccinate. We continue to vaccinate because we're trying to make sure that we are vaccinating our community and to make so that way we can prevent the spread of this disease and we can prevent patients from coming into the hospital with COVID-19 vaccine. So within this community, we continue to vaccinate. We continue to make sure that we're educating our patients, making sure that they're wearing masks, making sure there's testing being done in the hospital too for patients in the community. And I'm going to let Dr. Moorish, who is our Chief Medical Officer, elaborate more on some of the other services that we do provide for our COVID-19 patients in the Rockaway.
Thank you so much, Dr. Muir. And next, we will hear from Dr. Donald Moorish, who is the Chief Medical Officer at St. John's Hospital. Dr. Moorish? You're on mute, Doctor.
There we go. Good evening, everyone, and thank you, Ms. Brooks Powers, and the many other elected officials who are sponsoring tonight's COVID vaccine program. Community forums such as this are wonderful forums, and I'm honored to sit on the panel with my colleagues from the Joseph P. Adabo Center and my colleague at the hospital, Dr. Karen Muir. I am as far as background, I'm a board certified obstetrician gynecologist who has spent 21 plus years in serving underserved patient populations. I've worked within the Rockaway community for the last 9 years as an obstetrician, and I've gotten to know thousands of patients as an obstetrician, the chairman of obstetrics and gynecology, and now the chief medical officer of our 257-bed acute care hospital. As you had mentioned earlier, St. John's, as well as other healthcare leaders, lead the charge in addressing healthcare disparities within our community. And back in March of last year, as Karen had stated earlier, we saw the first COVID positive patient. And since then, we have treated thousands of patients, diagnosing COVID, treating outpatient patients on monoclonal antibodies, seeing patients in our ambulatory clinics, and taking care of acutely ill patients in the thousands. As you had noted, in many elected officials, our hospital was hit very, very hardly with the COVID. Being the only acute care facility within the Rockaway Peninsula, we were the second deadliest zip code, and not by poor quality, but by the mere fact that we are a geographically isolated community with 18 nursing homes and multiple adult homes within the area itself. So we are, as well as other healthcare facilities, trying to lead the charge in and vaccinating our community, diagnosing our community, and offering treatment modalities that best fits our community, and trying to work with locally elected officials to make sure the vaccine rollout comes to those in the most need, and that's all of our community. So I am pleased to be here with all of you and look forward to your questions.
Thank you so much. And wow, when you just dropped that statistic, it was, you know, it is alarming. The fact that we are living in the second deadliest zip code kind of puts into perspective what we already kind of knew in terms of being in such an isolated location, and how we were impacted by the pandemic, which makes it so critically important to have these community conversations to make sure that we are taking into account who's in our community, so we can roll this out in the most effective way and efficient way also possible. I know at the start of the pandemic, when it was about the testing sites at the time, we found that seniors was having a hard time getting appointments to be tested because of either not being versed on technology, or if there was like long waits on the phone. And so looking to, through this discussion, even find ways in which that we can come together and identify innovative ways as the rollout continues to take place, to ensure that we're reaching as many people in the community as possible, especially our vulnerable population. I know about a week and a half ago, I tried myself to schedule an appointment for a senior in the community, and it was quite cumbersome. And there, you know, obviously there was a shortage of the vaccine at that time, and there were no appointments available. So I would like to get into some of that too, like what people should do, how do they go about getting tested. But first, let's just have a brief conversation in terms of, is vaccination necessary? And if so, why is it necessary? And any of the panelists can, you know, be able to respond to that.
Yeah, so I would love to talk about that. I think the vaccine is absolutely essential to our patient population. Many of our patient populations suffer from comorbidities, hypertension, diabetes, COPD, and other issues. And the number one way in which we as a community can come together is to not only practice, you know, social distancing and making sure that we're not going into crowded areas, that we wear masks, that we wash our hands, but also that we get vaccinated. Medical literature across the country and over the last close to a year has stated that vaccines are safe, they're efficacious, and it's our responsibility in the community as healthcare providers to get these vaccines into the arms of patients who need it the most. And we believe at St. John's that that is our community. we were very fortunate when the executive order was rolled out, and Pfizer was one of the first vaccines to be accepted in New York State to receive the COVID vaccine, which was the Pfizer vaccine. And I'm sure Karen Muir could talk about it a little bit more. If you look at the safety record associated with the COVID vaccines, they're exceedingly safe. And I think the proof is in the pudding is that many of the healthcare providers that were offered at the first levels of care and the first vaccinations received them. We were able to administer over 1,200 vaccines to frontline healthcare workers within our system itself, mostly within the hospital, our community members in practice, and to making sure that they were safe and they could actually be the individuals who can speak to patients, stating how safe they were. I'm an obstetrician gynecologist. I see patients quite often, and I come in contact with them. And pregnant women are the most vulnerable individuals as far as vaccines are concerned, but all of our medical literature states that it's exceedingly safe to have your vaccine. Therefore, I think that vaccines are super safe. I would love to see thousands and thousands of them coming into our communities that have not received a tremendous supply before, but St. John's is certainly ready, willing, and able, and is doing vaccines of not only frontline healthcare workers, but also community members at this point in time.
Mm-hmm. And Sylvina, if I can add to what Dr. Morris has been saying, the thing is, COVID-19 disease is a disease like no other. I mean, you'll hear many people say, well, you know, I don't take the flu vaccine and I don't get the flu. They might end up getting the flu, but majority of the time, you know, we'll be okay. We'll get a fever for a few days, be knocked down for a few days, but you're fine. COVID-19, we've seen the news. We've seen the statistics. So the effects that COVID-19 have on people, especially those with comorbidities, it can't be compared to what the flu does, right? So this is why we have to treat this disease differently and look at it. Like Dr. Morris said, the vaccines are safe, and it's been proven from kids we've been getting vaccines, right? But this one, the concern is that, well, it came out quickly. So everyone is skeptical because it came out so fast. But the thing is, this technology that they're using allowed them to do it quickly. And not only that, they have been studying, like the Pfizer and Moderna, they use the messenger RNA technology for the vaccines. They've been studying that for about a decade now. So it's not something that just fell out of the sky. It's something that they've been working on, and they know the coronavirus very well. And the coronavirus is what causes COVID-19. So they've been working on this. But because we're in a worldwide pandemic, the entire world has been affected, people came together. And we know when people come together, what good we can do when everyone works together. So that's what they've been doing. People threw money into these research companies so they can go ahead and do the studies. And because so many people were getting sick so quickly, they were able to do the trials without waiting months to find people. Usually when we're doing the regular vaccines, you don't have so many people dying or getting infected just because they sat next to each other on the train, right? With this one, we have that happening. So people were volunteering for these trials, and so they were able to do it quick. A lot of time, the limiting factor is that you need volunteers to study, because you don't want to study just 5 people. With the Pfizer study, they studied about 43,000 people. The Moderna vaccine, they studied about 30,000 people. So they studied a lot of people. They didn't cut any corners. They did all the phases that we would usually do for vaccines. It's just that they were doing the phases at the same time. So all the phases were done like they usually do, but people gave money, which is usually a limited factor. People took risks, because even before the vaccines, the studies were done, they started making the vaccines. If the vaccines were proven to not work, a lot of companies would have lost money. But they decided to put the money into making this stuff because this was affecting everybody. This isn't a disease that was just affecting poor people or Black people. It's a disease that's affecting everybody. So everyone came together and worked together. Thankfully, we have technology now. Back in the days, like some of the vaccines that we're using, they use particular viruses to get it into our system. Even with the flu vaccine, they have to grow the virus first. So that takes a long time. But with the mRNA technology, the sequence that they have to do is something they do quickly in the lab. But this is not just to scare people or say, well, this technology all of a sudden, this cannot be good. It's a good thing. We praise technology for a lot of things. Look, we're able to do remote learning and all this stuff. So likewise, we have to praise and thank technology to be this successful at a time where we need it, like now in this pandemic. We can't wait 10 years like we usually had to wait for vaccines in the past to come up with a vaccine. Imagine 10 more years of people dying by the second, right? We have people dying every second that we're talking from this disease. So there's no time to wait. But again, no, they didn't cut corners. Everyone work together, and all these vaccines, they go through rigorous proofreading, like specialists, immunologists, virologists, who are not part of the pharmaceutical companies, who are not part of the government, so they don't have any money in this. They just look at the study to make sure that the things are safe, and they approved it for us to use because it's an emergency. You know, usually we don't have so many people dying at one time, but this is a different time. It's a different beast we're talking about. The coronavirus, I tell people all the time, we should actually thank God it's the coronavirus we're dealing with and not like a HIV virus that you can barely work with because it gets into your nucleus. With the coronavirus, they've been studying it because it was part of outbreaks in the past. It was part of the SARS in 2003, and it was also the cause of the Middle Eastern Respiratory Syndrome in 2014. So they're used to this kind of virus. So now when they came out with the SARS-CoV-2, they just needed to know the sequence for the mRNA, and they were able to do a vaccine quickly. So again, and also I know there's a lot of skepticism because people are saying, well, the government had something to do with it. But I mean, a lot of people in the government side, you saw, got infected too, so I don't think they want all their family members to die or or whoever to die. So this is why you can't look at that. Everybody is trying to work together to save lives.
Wow, I mean, that was news to me in terms of how many people actually were tested for this vaccination. So, I mean, that's good information to have. And before we go into the next question,
Can I just add?
Yes, sorry, Dr. Muir.
As Dr. Morris said before, this is a pandemic like no other. We've never experienced this before. This is the first actually in my lifetime. And given the sequelae of this disease, having the vaccine to protect from this disease is really important. What we do know is that currently the 2 vaccine that's approved by the FDA has gone through all the different phases that regular vaccine went through. As Dr. Veronica just pointed out, this is a messenger RNA. It's the first vaccine of our time that's like this. There's going to be other vaccine that's going to come out like this. This is technology in progress. This is technology happening. What we do know about the 2 current vaccine that we have is that they're safe. They're 95% efficacious. We've been vaccinating. Dr. Morris mentioned we vaccinated over 1,000 patients already. When you do vaccinate patient, we watch them for 15 minutes. We have yet to experience any anaphylactic reaction or any severe reaction from this vaccine. I myself has been vaccinated. I was given both doses, and I've had no side effects from this vaccine outside of having a sore arm for about 24 to 48 hours. So the vaccine is safe and it's efficacious.
Thank you so much for that. And before we go into the next question, I know we've been joined by State Senator Leroy Comrie. So I just want to give him a moment to give brief remarks, and then we'll go into the next question. I see the chat on Zoom is lighting up. So I'm actually going to start taking those questions instead of the ones that we already had, just to make sure that we're hearing from people in the community and they're getting the answers that they need. So Senator Comrie.
Thank you, Sister Brooks Powers. Thank you for putting this town hall together and creating an opportunity for people to have some more discussions about it. I want to thank the doctors that have been participating and providing great information so far. And I also want to, just encourage people to, as soon as you're eligible to be vaccinated, I would strongly encourage you to get vaccinated. I'm not eligible yet. I'm waiting, patiently to get the shot, but I know people, the doctor says she's gotten the shot. She's still standing and talking clearly and everything else. And I know my pastor, pastor that I spent most of my time with, got the shot. He and his wife got the shot, and Congressman Meeks got the shot. And I know that there are other people that are around the community that are getting the shot. You can look at the website and find out when you can be eligible to get the shot or to get on the list. But as the doctor said, it's important. This pandemic is not going away. It's not going to get abated until we get herd immunity, and even with herd immunity, for whatever reason, this virus is mutating into other forms as well. So it's very important that we get to do as much as we can to protect ourselves against it, so we can go back to normal life. I don't know about you guys, but I'm a hugger, and I miss, being able to see people and to touch people, and to have an opportunity to rub somebody's shoulder or back, or to say hello. So it's important that we get back to normal life as quickly as possible. And the only way that we can do that is, by taking the vaccine. And I want to remind folk also that there were Black doctors and researchers that developed this thing. It was developed in full daylight. It was developed with as much transparency as possible. The Pfizer and the Moderna shots were developed with a 98% efficiency, or 90 plus, not 98, but over 90% efficiencies for both of them once you take the second shot. So I think that it's important that, folks need to know that it would be safe for them to take it. So I would encourage people taking it and doing everything necessary to make sure that they can, be able to live a productive life. And with that, I'll turn it back over to Sister Brooks Powers to make sure that the program can continue. But thank you for putting this on, and I look forward to hearing other questions.
Thanks so much, Senator. So I'm going into the chat box right now. And one question we have is, if a person has antibodies, should they take the COVID-19 vaccine?
Absolutely, yes. Absolutely. All studies have pointed to the fact that we don't know how long natural immunity lasts for. So all the recommendations are stating once your turn comes up in the phase trials that you should get vaccinated too.
Thank you for that. The next question we have is, many of our seniors are concerned that the vaccine was created too quickly and are concerned that it won't protect against the new strains of the virus. How can we get the word out to them that the vaccine is safe and will work? And I know we answered that to some extent a few moments ago, but I think the tail end in terms of how we get the word out, like how can we create additional messengers through this setting right now?
I think having forums like this is tremendously helpful in getting individuals who are actually providing frontline care to get out and talk about their experiences with the vaccine and talking to individuals. I know within the hospital itself and in our ambulatory medical centers, we're trying to push out as much information and contact individuals who are susceptible to COVID with multiple medical conditions, that they do get the literature, that they do get the information from their providers, to push out information that we do offer outpatient therapies for those individuals who have mild to moderate COVID. And it's a simple injection or infusion of monoclonal antibodies, and that we are offering it to the community, and it is safe. I think speaking to healthcare providers is the most important thing that individuals can do to see what their risk is and to see when the availability of vaccine might be available for the individuals.
Selvina, this is one of those.
Go ahead,
Sorry.
Dr. Vega.
This is one of those issues that I had mentioned earlier about the 3 A's, right? Acceptability, availability, right? And this is about acceptability, and it isn't as easy as a provider talking to a patient. You have to move these individuals from pre-contemplation to being ready to take the vaccine and actually doing it. And at each step of the way, understanding what may be the barriers and easing their concerns about that. So yesterday I participated in a Red Hook town hall where we were talking about strategies and tactics to help the community move from skepticism to being ready to take the vaccine. And it takes a lot of partnerships, right? So we're looking to have our health clinic partner with community-based organizations, kind of like a brother and sister, big brother, big sister kind of partnership, where we go and meet with their community members where they are at, and we help explain, and then the word of mouth keeps going, and they hear it from people who are more trusted to them in the community, right? So it's building up and informing those gatekeepers and educating those gatekeepers so that way they can go on and educate the community as well. There has to be a lot of role modeling of the vaccine, and just being very, very honest and transparent, and break things down into very, very simple sound bites. At the end of the day, many seniors, what I have heard that will finally motivate them to get the vaccine, because many are skeptical and do feel that it was rushed. We did our own survey and found that as well. But what motivates many of them is if they get it, they'll be able to kiss and hug their grandchild. They'll be able to kiss and hug their child. And the gentleman earlier talked about how he's ready to hug people. Guess what? As human beings, we need to be touched or touch about 147 times a day. That is true. And so, this vaccine, this COVID has stopped us from feeling human. So if you could talk to people at that level and get them to realize they get this vaccine, we will be able to go back to feeling human and feeling whole. You can motivate them along the way.
I concur, but I also agree that it's really important to talk to your physicians. People do trust their physicians.
Absolutely. I didn't say not do that, but they also
Yeah, I
need
think
that.
it is
Yeah.
true.
So your physicians will help to calm those fears. Like one of the things that Ms. Brooks pointed about was mentioned was the new strains of viruses that's coming out. When you go to the barber shop or to the beauty salon, you hear people talking about the virus, that the vaccine, that they don't, clearly the conversation is that they don't understand the vaccine. But when they do speak to their providers, you have patients with different comorbidities, even healthcare providers. When we were vaccinating, they had questions. They didn't want to take the vaccine. And once we tell them, go talk to your physician, they came back. And we're talking about nurses that were administering the vaccine. After they had that conversation with their physicians, they would come back and say, oh, my physician said it's okay to take the vaccine. But just to know, to mention that the variant that came up now, Pfizer and both Moderna, has been tested against those variants, and they have protection against them so far, as we know, the two vaccines that we're using.
Now, Dr. Muir, you touched on something that I was thinking of also, just always kind of trying to think outside of the box. Like, how do we get this information out? And one of the questions kind of ties into what I'm about to say, because one of the questions says, how are you or your organizations informing the public about getting the vaccine on a regular basis? Some locations were not organized. For example, August Martin wasn't ready. Please explain. But before going into that, I will say we should be looking, and Dr. Vega, I know you sit on the governor's task force around this. We should be looking at thinking outside the box, right? So in our hair salons, in our barbershops, having information there. I know when work was being done in the nail salons with different regulations and health issues that they wanted to highlight and flag, they were going into the barbershops and the hair salons. And these are spaces also that some outreach may be able to be done in those spaces, having maybe pop-ups even in terms of where the vaccination could be administered, just like Dr. Wilshire and Dr. Vega did at the Joseph Piedabo Family Health Center in the beginning, where they created that tent to be able to do the testing. Maybe we can start to look at how do we push it out when, obviously more of the vaccination becomes available. But just briefly, if from both organizations, if one person can just highlight how are you informing the public about getting the vaccine?
Well, it's about relationships. And I think that that's what I touched upon before when I was talking about when I see patients and I have professional relationships with patients, and I've been taking care of them for 9 years in the community itself, and taking care of their family members and delivering their babies and taking care of their moms and sisters, I've developed a relationship with them where I'm trusted. And speaking the same language and understanding the different issues that each cultural or ethnicity might have at the time. I'm able to do that because I do see patients, and I think that's a really important thing. As I walk through the halls of my hospital, speaking to doctors, to nurses, to environmental services, to dietitians, everybody has a lot of questions about the vaccine, and we actually stand on the side and we talk about it. And I think informing our community, our patients, and being trusted in a community is very, very important. And it's a grassroots effort, and getting out in calls like this and talking to individuals and getting to know individuals, and also having a good track record of knowing your community, working in the community, and not just talking about the community. It's about those relationships and being trusted and understanding and addressing those areas in which patients really need it the most. And I think that's where you get the biggest bang for your buck.
So at Adabo, of course, the physicians and the nurses talk to the patients about it and inform them on what to do. We also, I personally go to the corner grocery store and I sit there and talk to people who go in, and I've talked to them about the vaccine. And apparently now all of Red Hook has my cell phone number, and they call me all the time asking for the vaccine. I've received like over 500 calls on my cell phone. So we have been working really, really hard to get out into the community, work with the local churches, the food pantries, the methadone clinic down the block, and letting people know about the vaccine, the housing projects across the street, try to work with NYCHA. So we've been really doing a lot of outreach to key stakeholders, and letting them know. And then, in our waiting room, we also have the video that talks about the vaccines. Also, our board of directors act as, emissaries out there and talking about the vaccine and letting people know. I think a lot of people are very knowledgeable that we have the vaccine, to the point that our operators can no longer handle the phone calls coming in. So what we're actually trying to educate people on are the phases and how the vaccine is actually rolled out, and how, everything from the vials and the number of doses, so that way they can understand why there's a little bit of a wait and why they need appointments. So we've been doing a lot of education on that logistical part of the vaccine rollout as well.
Thanks so much for that. From both you, Dr. Vega, and Dr. Moorish on that response. We have another question. There's some refusal in taking the vaccine. Does the vaccine have MRC5 in it? Is there a possibility of laterogenic reaction as an adverse reaction caused by multiple compounds or drugs interacting with each other from the vaccine? And are all the doctors, nurses who are administering the vaccine asking the patients the medications they are presently taking?
So, Selvina, I can answer that actually. So, what we have to make sure people understand that this vaccine has basic things. So for the Pfizer vaccine and the Moderna vaccine, we mentioned that they have the mRNA, which is the messenger RNA. Not to be confused with DNA. It has no genetic DNA in it. mRNA is the main one, but mRNA is very fragile. So in order for it to get into the system as a vaccine, they had to wrap it with something. So they wrapped it with a lipid it's a nanolipid, and that lipid is it's made out of what's called polyethylene glycol. And that's what sometimes can cause some allergy to some people. But the polyethylene glycol is something that's found in many other medications that we take. There's this thing called Miralax that a lot of people with constipation takes. So it's the same kind of substance that's in it. So you have the lipid. The next thing we have is sugar. And the reason why they have the sugar there is so that way it can protect the vaccine as it's going in when it's frozen. Because if it's frozen, you want it to not stick together. So the sugar helps that. The other thing it has is some salts, regular salts. And the reason why they use those salts is to help to keep the pH the same, because with the vaccines, they wanted everything to mimic our body system, right? So they didn't want anything too acidic. So they put certain salts so it can be the same way. They have saline solution in there, again, which is usually in like the IV bags that people get if they get sick in the hospital. That saline solution is just to match the salt content that we have in our bodies already. So in the vaccine, there's no preservatives. So there's no mercury, there's no thimerosal, there's nothing that's gonna cause any strange reactions. It's just that some people do have allergy to these components. So one of the things you have to not take the medicine if you have severe allergy. But again, most people are not allergic to lipids and sugars and fats, but some people are allergic to the polyethylene glycol that's in the lipid that can cause the problem. So it's a very basic vaccine, okay?
Thank you so much, Dr. Wilshire. And then we have another question that we asked that you all consider. I'm not sure if one from each organization can respond. And that is, many of our seniors are waiting to speak to the doctors, but admit they have not reached out to them. What can the healthcare facilities do to reach out to the senior patients? And that's a real question, especially considering in light of the pandemic, a lot of seniors have been more sheltered in over the course of the past 11 months. To make sure that they remain safe and not expose themselves. And so is there outreach being done to the seniors as well through the healthcare facilities?
Yeah, we have a very robust ambulatory network of primary care as well as specialty care providers. And our staff is going through lists of individuals who might be at the highest risk and trying to not only just reach them by phone, but make sure that they're being covered for any of their chronic medical conditions and reaching out to the individuals too. We offer inpatient visits in proper infectious disease protocols. We offer telehealth visits. We offer telephonic visits, any way in which our seniors can reach us and we can reach them. We've been opening up the lines of communication and ensuring that although there might be socially distant or away from our centers, that we are in constant contact with them and always keeping in front mind their challenges and their healthcare delivery. So yeah, we've been reaching out to our patients on a regular basis. We have transition of care teams. We have care managers. We have physicians, nurses, frontline staff reaching out to patients on a daily basis. So we feel that we are really trying to cover our patient population well and educate them as best we can to not only address the COVID needs, but also their chronic medical condition needs too. Medication refills, vaccinations that they need to keep up with are really important care that they need to be provided and not forgotten and just focus solely on COVID itself. So the St. John's Medical Group and primary care and specialty care services are doing a fantastic job in covering our patient population.
Dr. Wilshire or Dr. Vega?
Sure, sorry, I was on mute. Yes, you know, we constantly comb through our panels and lists of patients and reach out to them. We too offer telemedicine. You know, we're also working with some community-based partners. We're trying to do, say, a senior COVID vaccine day. We had hoped to do it this Monday, actually, but then we had to shut down because of the snow. Um, and um, and what that entails is that they bring them over to us, and it's during a time when we can try to make sure that they do remain socially distanced from others. It's kind of like how Walmart has special times for seniors to go there. So we've been trying to do that also at the Red Hook Clinic and some of the other clinics. And as you know yourself, Sabina, you've been able to bring seniors to us for COVID testing. So we've always prioritized seniors. We know they're very vulnerable, and so we will do what it takes to get them the help to come in and get this vaccine. Anyone over the age of 65 is now eligible. We are in 1B, phase 1B, transitioning to 1C. Restaurant workers are now also eligible, etc. as of today. So we just keep moving forward, but the seniors are eligible, and we're doing everything possible to get them in.
I'm glad that the restaurant workers are eligible now too, because they are definitely frontline workers as well. And you know, this pandemic has really been able to shine a light on who are really inclusive of that title of essential workers. Also, the people that take care of us, make sure we're healthy, make sure we're fed, make sure we're able to get groceries. All of those different constituencies is very important to make sure that, you know, they have that access also. And I know, Dr. Vega, you had mentioned about working with community-based organizations, including with NYCHA, and I'm glad to hear that, especially because I know with the rollout of the vaccination, there were NYCHA developments targeted. I was upset when I heard that none of them were coming from Southeast Queens and the Rockaways, though, especially with how hard our community has been hit. And so it's my hope that they will become prioritized and will be able to be in that next wave of rollouts as well, because I think it's important to recognize and look at the disparities that we've been seeing and to address them head on. And so we want to make sure that our community is not being overlooked in that space, which leads me to the next question. Would St. John's be willing to partner with, it says, our senior centers and senior housing to get vaccines to our participants? And from the question, I know that comes from the Greater Allen Cathedrals. They have senior housing, and so that's located in St. Albans and Jamaica, Queens. And so would St. John's be willing to partner with the senior centers there and the senior housing to get vaccines out to the patients?
So one of the things we did very early in the vaccine program that we had is that New York State Department of Health and the state government had asked individual hospitals and other healthcare facilities if they're willing to partner and to provide the vaccine to communities. And the issue is, at this point in time, is that we're limited because we don't have enough supply. We had signed up to do public vaccinations and do partnership programs itself, but we have not been given the go-ahead, secondary to the fact that New York State has not received a sufficient supply of COVID vaccines to distribute to these patient populations. We're ready, willing, and able. We just need to have the vaccine allocated to our facility so that we can partner with community-based organizations, housing authorities, and other community members to make sure that we do vaccinate them. But once again, we can't do what we don't have, but we are looking for it. And we probably were one of the first facilities to sign up for the program. We just have not been allocated the vaccines itself. St. John's, unfortunately, had gone through a period of time for over a week where we had not received any first vaccines. We just recently received a small amount, and we're still going through all of our healthcare providers, trying to hit those individuals who are greater than the age of 65, those frontline individuals who have multiple comorbidities, those individuals who are most vulnerable, to get them vaccinated first and hopefully start to roll out to bigger and bigger communities as the supplies come available to us.
And that's a conversation that we continue to have with the city because of the need to vaccinate the community. So that's an ongoing conversation. We continuously try to procure vaccine so that we could get into programs as aforementioned.
Yep.
And Dr. Morris, please let me know when that time comes, because I also have a number of clergy leaders who have reached out and have been inquiring if I've heard of any of the healthcare partners willing to collaborate in this effort. So I can share that with you also, as well as with the Adabo Center as well. So another question is one vaccine more effective than the other? And I'm going to ask Dr. Muir if you want to answer that question. You're on mute. You're on mute. We're going too.
The two vaccines now that's currently approved by the FDA has been proven to both be 95% efficacious, and that's the Moderna and the Pfizer vaccine that we're currently using to vaccinate. So as far as I know, none is better than the other. The only difference with these vaccines is the way that they're stored. The Pfizer vaccine requires an ultra cold freezer and has to be stored at -70 or less degree. And the Moderna just has to be refrigerated. The Moderna requires 4 weeks after first vaccination, and the Pfizer requires 3 weeks after after first vaccination to get the second vaccine. But as far as one being better than the other, and they're both mRNA vaccine, they're both made pretty much the same way. None is more efficacious than the other.
Thanks so much for that. And going back to the testing or the studies that have been done, a question came in terms of how many of the persons tested were of color. Like, what's the ratio of that? Did it cross? Was it done across various age demographics also?
Yeah, so Sylvina can answer that. So what they did, especially for the Pfizer and Moderna studies, they tried to mimic the population. So they had people from all different ethnic groups, different race. So just like how, you know, we have whites as the majority in the US, blacks as a minority, it was like that. So in the Moderna study, for instance, there were 10% blacks who participated in the study. So, of course, we don't expect the blacks to be the majority because in the general population, we're not the majority. So, but we had representation. They also didn't just study people from the US. The studies took place in Australia, Brazil, South Africa, so different places and different age groups. So for the Moderna study, we had people from 18 years of age and above. And the Pfizer study, I believe it was from 16 years old and above. And also they used people with multiple different conditions. So people with diabetes, lungs problems, so with obesity. So it wasn't just all healthy people, it was people with multiple different medical conditions. So it was very diverse.
Okay, thank you so much for that. Another question, is there any real-time data on people who are immunosuppressed receiving the vaccine? So Dr. Morris, I'll just ask if you can answer that one.
Yeah, there's an advisory committee for immunization practices that constantly monitors. It's in a group of medical and public health experts that carefully review safety, efficacy data on vaccines. And they do take a look at these subpopulations itself. And they are feeling that the fact that anybody who is immunocompromised do receive the vaccine and are faring just as well as those who do not have immunocompromised states itself. And that's actually taking into factors of using PPE, social distancing, and so forth. So it has been studied and it is ongoing at this point in time. But the numbers addressing this immunocompromised patient population is showing that this is equally efficacious.
Can I chime in here? When I mentioned, I think I mentioned in the chat box, and I keep mentioning this, that you need people of color, right, being role models and taking the vaccine publicly and being open about it. And I was very open with many people and with my staff and the public about how fearful I was to take it because I suffer a lot from allergies. I do carry an EpiPen, and I am immunocompromised. And so, you know, I took the vaccine, I took Moderna, and I'm fine. So I keep going out there and letting people know that. So that way they can see someone that looks like them, that has the same fears as them, the same problems, who took it and is okay. And of course, and I'm just an anecdote. Obviously, you want to look at larger scale studies, but I am more than happy to share my personal story if it helps people out there.
That's good to know, because I have extremely bad allergies myself. And so I was wondering that for my own personal self as well. So thank you for sharing that, Dr. Vega. Another question came in. Can you still donate blood after having the vaccine?
Yes, you sure can. I think it's really important that individuals understand that donating blood is an essential element of everyone's life, and that they should be donating. And yes, actually, patients who do donate, even after exposed and have antibodies to COVID, can still donate blood. Obviously, if you have active COVID, they would suggest that you do not donate. But yes, you can donate at any given time if you do not have COVID, or if you had COVID, or if you had the vaccine. We still suggest that you do donate blood.
And we had the question that I was waiting to see in the chat, because I know when I talk to people in the community, I hear it all the time. I am a senior. Where and when can I get vaccinated? I'm hearing this everywhere. People want to know when and where. And if you could also give information as to how they can schedule to get vaccination, what that looks like, that would be helpful. I know both facilities are distributing the vaccine and may be aware of other locations as well. So I'll ask if both organizations can speak to that.
From St. John's point of view, we're waiting for a vaccine supply that we can provide to individuals who are 65 and greater. We're starting in the planning stages of how we can roll it out to the community, and talking to the New York State Department of Health as to what our role will be within the community itself. So we're still in the planning stages. We are providing a limited amount of vaccines to individuals at this point in time outside of the hospital facility itself. And then we're in the planning stages. And once we get the system in place, because it is complicated, and we want to make sure that the vaccines go to those individuals at need the most, gets to them first. We're right in the planning stages right now. So once we get that information, we will share it with everyone.
Hi, at Adabo, we've already started vaccinating the community, right? We're through 1C now. But the supply is extremely limited, and appointments are absolutely necessary. Once we open up, that's why I was saying I was trying to educate the public on the actual logistics of doing the vaccine rollout, because it's very complicated. We're trying to provide the vaccine to as many people as possible, but we just do not have the supplies. The supplies are extremely limited. We were supposed to get at the state level 16% more this week, but with Cuomo shutting down the interstate highway, supplies have not made their way to the state yet. So everyone's waiting for the latest shipment of vaccines. So, right now,
so it sounds like it's week to week. So it sounds like almost it's week to week.
It is most certainly week to week. And once we receive the vaccines for the first dose, we have to use them, administer them within 7 days, as per the executive order issued January 5th. So once we receive the vaccine, we move very quickly to call people who are eligible. We have a waiting list going. And we just call people up, and who can come in that day comes in, and then we just keep rolling it.
Wow. Looking forward to us getting much more supplies here in the state and in our community, because it's definitely needed.
Because Sylvina, if I can just add to all of this, because the problem is going to become just like the problem we had before, which is the underserved areas are gonna be left underserved, because what I saw with the amount that we got, people who are more savvy with their computers and so on, they're able to get access to these places. They have their transportation. They're able to travel 2 hours to go wherever. So the seniors in our community that, you know, who are not tech savvy or don't have access for transportation, you know, I've had grandmothers come to me and they're like, oh, well, where do we get the shot? I didn't hear about the vaccine. So they're not getting the message. And even if they hear about it, they don't know how to sign up. You know, it's not easy. They don't know how to get there. So, I mean, we have to advocate to make sure that places like Far Rockaway, who suffered the most, get the focus and send enough vaccines so we can make a difference in those communities. Because again, we have a lot of essential workers, a lot of people who are undocumented and so on, a lot of people who don't really know English. So we have to be a little more cognizant of that and represent those community members.
No, definitely. We need to continue to beat the drum on it, because you know, it's a fact in terms of the statistics and how we were impacted here in the community. And so one would think that the natural response would be to ensure that we have enough vaccines here. So thank you for highlighting the fact that we need to, as a community, continue to beat that drum and advocate to get these resources here into the community. Also, in terms of reaching our seniors, I would, and I'm not sure if you do this, but I haven't seen one myself, I would suggest also using our local publications to reach the seniors by putting an ad out to say, this is what the process is, and you know, how do they get onto a waiting list, you know? And I found it most effective just in the experience with the testing. You know, people were able to just call me and I put their information in a spreadsheet, you remember, and I just emailed it to you, and they didn't have to worry about waiting on hold or whatever. So if you had several different community partners doing this and feeding in this information on behalf of the seniors, it probably would be most effective, because, and I see it in the chat, a lot of seniors don't have computers, even though there are some seniors that are a bit more technologically savvy than me, but yeah.
That's what we're doing, right? When I mentioned that on Monday, we were going to have senior day. So we were partnering with someone. They got all the seniors lined up for us, and they were just going to then come in. But then the snowstorm came in.
Yeah, the weather, yeah, and it has to be in a way that they don't have to wait outside.
Exactly. That is the best way to do it. We really want to partner with the communities.
Yeah.
And then the community members, the nursing homes, the community-based organizations gather those lists. They give them to us. We put them into our panels for the day, and they come in and we go boom, 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 vaccinate, right?
Exactly.
Yeah.
And
we don't want them trying to get through a long phone line or anything. We want them to come in right away.
Good. And can undocumented immigrants receive the vaccine for free?
They have from us.
Okay.
Absolutely. I think every healthcare facility would be more than happy to do so, and not just from one facility itself. I think everybody shares that thought process.
That's good to know. What services are available for seniors who are bedbound to get the vaccine? That's a good question.
So those individuals who are bedbound, most of the times they require either at skilled nursing facilities, and the skilled nursing facilities in our area have been provided COVID vaccines for each of their individuals. I think home health care agencies that reach out to us at different times that do ask it, we try to make the accommodations to do so and try to treat this patient population depending on what the special circumstances are. So it's a case-by-case basis.
And then if like someone doesn't have ID, are they able to still get vaccinated? Like if they don't have insurance, like any like driver's license or social security card, they can still get vaccinated, right?
Yeah, it's just a matter of it. As long as they fit the criteria of being greater than 65, have one of the 1B to 1C categories, they fall within it. I don't see any barrier to being vaccinated whatsoever. We feel that everyone and everybody should be entitled to one. Everyone is entitled to one, and there should be no discrimination as far as that's concerned. Each and every person to us is very, very important to our community.
And will a person need to be tested for COVID-19 before getting the vaccine? And anyone can answer that question.
No.
No.
Okay. Okay.
And so, Vina, just to add to that,
Yes.
because we don't test people for COVID-19 before they get the vaccine, sometimes what happens, someone comes for the vaccine, but they already have the virus and don't know that they had the virus, but they're just not showing symptoms. So then say 3 days after they start showing symptoms, then they say, oh, well, I took the vaccine and I end up getting COVID, you know? So that's how, you know, you start getting these negative comments from the vaccines. But one has to remember, in the vaccine, there's no coronavirus in the vaccine. So there's no way that one can get COVID from the vaccine because there's no virus in it. So if you get COVID-19 anywhere between that time, it's not from the vaccine, it's that you picked it up from somewhere else. The vaccine takes at least 14 days for a response to build for your body to build up immune response. But again, you don't get the full response until you receive both dosages. So for Pfizer, that will be after 21 days. For Moderna, that's after 28 days. So you still have to do everything, take all your precaution, and know that you're not fully protected until you take both doses. And again, like Dr. Karen said, they're 95 and 94% effective, not 100%. So that means that some people still are gonna get COVID-19 even after the vaccine because it's not 100% effective, but it wouldn't be severe, and that's much better than anything else. We don't want to have severe COVID and end up in the ICU.
Right. So we don't we don't test patients prior to giving them the vaccine. But what we do is a screening. And if patients are positive with any of those screenings, we do refer them to go get a COVID-19 test. So if you come in and you haven't had a fever, all of those questions that we ask prior to you coming into the hospital or coming into any of our services, if you're positive to any of those, we will not administer a COVID-19 vaccine. We will refer you to go get a COVID-19 test.
Okay. And so we're at 9:32, and I appreciate everyone's time here. So I know we still have a good amount of questions. So I want to try and have the responses from maybe one at most of the experts here, so that we can try and answer as many questions as possible, because I think it's so important. I know I see a senior here that wrote, it's really frustrating to get an appointment, and I'm 69 years old, and that's something I consistently hear just throughout talking to some seniors. So that was more of a statement. But there's another question that says, what is your recommendation for a 63-year-old woman who is asthmatic and have bad allergies? Well, that one was answered. So I'll say that was answered live because Dr. Vega answered that. Would you recommend the 66% effective vaccine from Johnson & Johnson?
I think anybody should, any point in time, have access to any vaccine. They should take the vaccine and not give up their spot in line whatsoever.
Okay. And then the next one, I've heard overwhelmingly about African American and Hispanic community rates of COVID-19 contraction. I'd like to know if data has been captured to delineate acquired COVID cases for frontline workers, seniors, people with comorbidities, et cetera, of other ethnic groups in various communities. And if so, why we don't hear about high rates in other communities with similar demographics and health issues. Also, what are the breakdowns of ethnicities that participated in the vaccine study, which I think a part of this was answered earlier, but in terms of the other ethnic groups, does anyone have an idea or a read on how the contraction of COVID-19 fares compared to the African American and Hispanic communities?
The thing is, you know, like I said before, they have ethnic groups in the study from all over: Asians, Hispanics, whites, blacks, just like how the breakdown is in the general population. So for the Moderna study, 10% of the participants were black. But the thing is, again, people with chronic medical conditions fare worse because they already have inflammatory process that's going on. And when you do catch COVID-19, it caused inflammation to the different organs, to the lungs, to the heart, to the kidneys, and cause problems, like that. But what we find is that sometimes, like Blacks and Hispanics, they have problems with access to medical care. Sometimes because of their jobs, they're not able to follow up with their appointments as much as possible. So, and they're not keeping up with their follow-up appointments. So I think it's a multifactorial kind of thing that adds to them already having chronic medical conditions. In our genetic makeup, we're prone to diabetes. So this is why we always stress to make sure you eat right and you exercise, so that way you don't have to end up as a diabetic like your grandmother did, or with hypertension like your grandmother did. So it's a conscious decision that we have to make. But sometimes it's difficult because when you look in the neighborhoods, you don't even have healthy food places for them to get healthy options for. You don't have parks for them to go and exercise outside. So this is why it becomes like a cycle. So we see everything just becoming worse for Black and brown people. So it's not that other people can't get it, but we have a lot more other factors that's making everything worse.
When you speaking truth to life, Dr. Wilshire, I mean, that's like a drop mic moment, and it's true. Like in our community, we see a lack of a lot of different resources and elements that could help to foster a healthy lifestyle and to be able to combat a lot of these underlying conditions. So thank you for highlighting that. And that's something that we as a community have to continue to fight for and demand, because when we have dynamics like this, where we're faced with viruses that disproportionately impact our community, this is examples of why we need to make sure that we have the proper healthcare access and have more than one hospital when we're in such a tight space as the Peninsula and Southeast Queens. So I'm glad you highlighted those areas. There's another question, this is a good one also, that I've heard a lot about also, in terms of not only just what the impact of the vaccination is today as you get a shot, but what's the long-term impact? So the question says, I don't think most people are as concerned on how one is feeling immediately or weeks after being vaccinated, but more so a year from now. How many times do you see a commercial that says, if you used this 20 years ago, you can join our lawsuit? I know there cannot be any studies on future ailments, but is there any commentary in regards to that?
Mm-hmm. So the thing is, Sylvina, this is a brand new virus that we're dealing with, and we're in the middle of the pandemic. So that's what I'm saying. Some people want to wait and see, but again, we'll wait and see, but every second, that's more of your relatives that's dying. So we can continue to wait and see, or we move by faith and just go ahead and try. And based on the past, the vaccines that we've had from before, we know that long-term years, like say 10, 20 years from now, from taking an MMR vaccine, it's not gonna cause any problem. From research, it shows like sometimes like 1 in a million, you might see something happen. But again, 1 in a million for 20 years from now, as opposed to the amount of people that are dying as we speak, you can't compare. So this is what we have to look at. So we can't be so focused on what's going to happen 20 years from now, when we know from looking at past vaccines, they don't have those things on a regular. Anything that we take that's new can cause issues. New foods, new medicines, and we trust all the medicines. I mean, people take Pfizer medicines. I forgot the one that the men use, for their erection and stuff, but that's made by Pfizer. And the men, I don't think men were just lining up saying, what's gonna be the effect 20 years from now? They took it, So we have to trust that the scientists studied hard and they want what's best for us, and we go ahead and do the right thing.
Thank you for that, Dr. Muir.
say that I do concur with Dr. Wilshire. Um, we're still in post-marketing phase of the vaccine, so we don't know now what the long-term effects are going to be, if any. But what we do know is that contracting the COVID-19 disease does have residual effects long-term, and we do know that it does result in mortality.
And while we have you, Dr. Muir, I was coming to you with the next question also. How long does protection from the COVID-19 vaccines last?
Well, that information is not cemented yet. I know that it's about a year right now. So we don't know if this is a vaccine that we're going to have to take annually, how often we do need to take it. But there has not been sufficient information as to the length of it. But we know, I think it's about a year. Dr. Veronica, do you have anything to suggest otherwise?
No, I definitely agree. And the reason why you're able to guess about a year, because they kind of know how the coronavirus works. So viruses mutate all the time. Some very, very quickly, like the flu. That's why every year we have to get a flu vaccine. But the coronavirus doesn't mutate as much as the flu vaccine, but it still mutates. So we most likely would end up having to take it a little more frequently, but they're thinking about a year or 2 years. And with the new variants that's coming out, so far it's proven to be effective against the UK variant and I think the South African variant. But the more people that get infected, the more variants are going to come out. And so it's probably likely that we're going to have to end up getting a booster vaccine at some point, which is okay, because coronavirus is going to be around. It's going to be around, you know, probably forever. It's been here for years. That's what causes the common cold. But viruses mutate. But this is why we have science. People are going to continue to be in the lab and continue to study it. And we have technology. So if we have to make a change, it's going to be very quick. We don't have to wait 10 years for them to fix the problem. It's going to be very quick.
Thank you for that. And so I see we have the executive director for the Allen Development Corporation, who said that she would love to be a contact that you can call on when you need last minute seniors to get vaccinated. I'll offline connect you with her. Next, we see, are the appointments automatically made for the second dose when you go for the first dose at every site?
Certainly, I could answer that. When you do walk in and we give you the first dose, there are cards that gives you appointment immediately for your second dose.
Thanks so much for that. And can a person choose which vaccine they receive? And I think from Dr. Morris, I got the sense that he was saying whatever vaccine you can access, you should access. Is that the case?
I didn't have the option of choosing the vaccines that I received. We were just so happy to get vaccine. So you just get what you take, what you get. But no, there is no option to choose. I think we got Pfizer vaccine because we had the ability to store it. I'm not sure what Adabo received.
Yeah, right. We received the Moderna because, again, for the Moderna, it doesn't have to be stored in an ultra cold freezer. So the Pfizer vaccines went to mostly hospitals, whereas the Moderna vaccine went to like the community clinics and so on, because we don't have that option for the kind of storage that the Pfizer vaccines require. But like Dr. Karen said, you know, both of them are pretty much the same. So you take whichever one becomes available to you, and you know, and you'll get the same level of protection pretty much.
And what we do know is that if you were given a Pfizer first dose, you will be getting a Pfizer second dose, and same with Moderna.
Thank you for that. Who's authorized to administer vaccinations? Someone said they recently saw an ad at Walgreens drive-thru.
Pharmacist is authorized to give vaccinations. The community pharmacists are vaccinating in some cases based on the governor's executive orders. Nurses are authorized to do so. Physicians, of course, are also authorized to do so.
Mm-hmm.
Walgreens drive-through? There's no, who's got a Walgreens drive-through? Interesting. Okay, sorry. I'm on mic? Sorry.
Yes, Senator, you are not on mute. After the second injection, is there any type of follow-up to determine if the vaccine was effective?
So usually there's no follow-up. We know from the trials after the 2 dosages, you will develop antibodies. But some people, if they're curious, I've known people who go and check their antibodies to see how well their body produce the antibodies. But you really don't have to. We know that after the second doses, your body will cause you to have the immune response that you need. And this is why you should get the vaccine and not rely on getting the antibody from just getting COVID disease, because just getting COVID disease, we don't know how robust of an antibody you would produce. Whereas with a vaccine, we know that you will get a robust immune response. So it's safer to just go ahead and get the vaccine like how it's recommended. And that way you know that you're gonna be safe.
Thank you for that. So I'm going to ask the final question, and then we're going to go ahead and wrap this up. We are at 9:46, and the intention was for it to be 90 minutes, but I wanted to be able to ensure that we got to everyone's questions. And our panelists have been so gracious and answering every single question that we've gotten. So I'm going to ask this one last question, which is, there are many vaccines that are taken in childhood and perhaps a few boosters needed in adulthood that we have taken to maintain those teethers. In an effort to provide clarity and assuage concerns over the COVID-19 vaccinations, is there a way to simply explain how the COVID vaccines will work?
So, as far as the vaccine, like we said, it's a mRNA vaccine. It gets into your cells, and the mRNA, the messenger RNA, what it does, it tells your body it gives your body the instruction to make a particular protein that's called the spike protein. That's the protein that's on the coronavirus that does the damage. And mind you, all of us have mRNA any given time in our bodies because it's what gives our body the messages to do things. But the thing is, once we receive that vaccine, the mRNA quickly disappears. It breaks down, so it doesn't stay in your body. But what it does, it gives your body the instruction to make that protein. Because it's something that's foreign, your body now builds up the antibody to it. So that way, if you're ever exposed to the coronavirus that causes COVID-19, your body is going to remember it and fight it off because you have the antibodies that you build up. So that's how the vaccine works. The vaccines in the past, the MMR vaccine, varicella, they work similarly, but they didn't use an mRNA. They used a live virus, but the virus is weak. So the virus wasn't potent enough to cause the disease, but what it did, it was enough to cause an immune response. So that way, again, if your body was exposed to the chicken pox or to the measles, it would fight it off. So the same thing here. But is like in kids, when kids first get the MMR vaccine at 12 months, then they get another booster at 4 years old. When they first made the MMR vaccine for kids when they were 12 months, they didn't know that eventually they're gonna need another booster 4 years from now. But with time, they realized that it wasn't as effective 4 years later. So then they gave the booster. So the same thing here. Right now, they know that after 2 dosages of the vaccine, we're gonna build up a good immune response. We're still studying it to see how long it's gonna last. Maybe it's a year, maybe it's 2 years, we don't know. But what's making it difficult is because the virus keeps mutating. And more people who get infected, the more and more viruses mutate. So far, we see the vaccine is doing a good job, still being effective against those variants, but there might come a point in time where the vaccine isn't going to be as effective for those variants, so they'll get a booster. Okay, and we'll probably just have to take the booster, and and it's better that way than to know that we have a weapon to fight this thing than to not have anything. So
Thank
that's
you.
basically how, so that's basically how it works. So everything is still pretty new. They're still doing a lot of research and studying. And as time goes on, we're gonna know how long it's gonna take for us to need another booster.
Absolutely. And so also on here, we have Dr. Deborah Hoyle, who wanted to highlight that Ocean Bay Cornerstone, which is located in Auburn, is also interested in being a partner. So offline, I'll make that connection as well. And before I give closing remarks, Dr. Vega, I would like for you to share with folks, especially our seniors. I made sure I did the call-in feature also on this, which we have some people who dialed in to make sure that they were able to access this very important information. How can our seniors get an appointment to be tested? How can they get on a waiting list? And I don't want to limit it to just Rockaway, because we have people who are listening in that are also from other parts of Southeast Queens and possibly other parts of the city and state. So is there a central place where people can either dial in or go online to be able to get this? Do they go through their doctors to get vaccinated? What are the steps that people need to take? And just also reiterate what phase we're on and which one we're going into. And I'll give closing remarks after that. So thank you.
Okay, sure, no problem. So we've been through phase 1A and 1B. And 1A was like healthcare workers, et cetera. And 1B now we're on people over the age of 65, firefighters, et cetera. We're entering 1C slowly. Today, the government announced that we can start giving the vaccine to restaurant workers. So we're slowly moving through these different phases. And these phases were meant to identify those individuals, right? So phase 1A are those people that may have primary contact with people who are COVID positive, right? And so we wanted to protect them since they're working at large with a lot of possible exposures. So as you go through the phases, you're addressing people with possible exposures or people who have multiple chronic health diseases that may put them at great risk. So we're now entering slowly phase 1C. So that's the phase situation. And then in terms of appointments, I know I've seen all the listservs, people writing everywhere that it's so hard to get an appointment. It is hard. I'm not going to sugarcoat it. We have limited supplies. The vaccine doses are just not here for us at the steady stream that we need. So there's going to be a wait list. I'm so sorry. You can talk to your provider when you're talking to them to see how you can get onto the wait list. You can also try calling Adabo, but our lines are crazy busy right now because so many people are calling. So if you want to reach Adabo, we do have a place on our website where you can request an appointment, and through there you can request an appointment for the COVID vaccine. If we don't get back to you right away, please don't despair. It's just that the list is humongously long and the supplies are very short. We're trying to get through it. We hope and pray for the day where the supply gate opens and we can just vaccinate everyone who would like it. But at the moment, when we get the appointment requests, we do prioritize them according to the phases.
Thank you. And Dr. Muir, how about at St. John's in terms of how can the community get on these waiting lists? How can they make an appointment, especially the seniors?
Right, so as Dr. Morris alluded to before he left, we're still working out with the city to get those vaccines. And once we do get it, we will be reaching out to the community and the community partners to get individuals vaccinated.
Thank you so much. And thank you so much to those who tuned in for this lengthy discussion around the COVID-19 vaccination. I thought it was critically important for us to have this conversation because I hear it from both sides. I hear in our community people who are not necessarily trusting of the vaccination. I've heard, it came about too quickly. Why the minority community in the beginning, it was, why are we being prioritized all of a sudden when we weren't prioritized for the testing sites? Then you hear other people who want to go back to some degree of normalcy and want to have the vaccination. And so I thought it was important to bring together this panel to have these conversations and answer every question that we have so people can make an informed decision. And it's not on me or anyone on the panel to tell someone what they need to do, but in order for us to return to some level of normalcy, we want to make sure that we're making a decision that's based on facts, so that we're able to protect one another. This is a virus that is not, discriminating. It's catching everybody, no matter how rich you are, how poor you are, no matter if you live on the East Coast or the West Coast or Rockaway or Westchester. Everyone has been touched or impacted by this pandemic. My own mother tested positive from COVID-19. My sister has tested positive from COVID-19. I lost my uncle at the beginning of this pandemic. It's something that's very personal to me, and that's why I keep on coming and beating this drum around COVID-19. And it's also removed the veil from a lot of disparities that we continue to see in our community, from food insecurity to a number of other issues. Even when you talk about access to quality healthcare resources or access to quality foods, and my family's Jamaican and food is like the best medicine, and you want to make sure you have access to that, right? And so, this is just another reminder to look at the facts and weigh the pros versus the cons so that we can all get back to some degree of normalcy. So we hope that this was helpful and informative to you. I hope that some of these seniors that I've been talking to in the streets that asked for more information was able to tune in so that they could get this information. I will make the video available on my Facebook page. I will also email it out so that people have access to this, and you could take your time when you have a moment or about an hour and a half or 2 hours that this was, to listen to this information and play it back. And thank you once again to this esteemed panel. Thank you to our partners for making this possible. And I hope that everyone continue to remain safe, wear your mask, practice social distancing, and when is the time for you in terms of this phase rollout, I hope that you make an informed decision to keep you and your family safe. So thank you so much.
Excellent job, Sylvina. Stay safe, everybody. Have a good night.
Okay.
Thanks, Senator.
Thank
Good
you so
night.
much.
Everyone.
Good night.
Good night.
Goodbye.